Hi, welcome back to our channel, Medicare Secrets. Holly Cohen. I am the co-founder of Preferred Medicare Plans. My team and I, we have been doing this combined experience for over 23 years, explaining Medicare. We're focusing on Medicare for you today to explain how it works and some of the secrets behind it. Okay, so let's get started. What is Medicare? What is original Medicare? What is Medicare Advantage? So let's start with what is original Medicare? Original Medicare is the program that started back in 1966, and it was designed to help people, all of us, pay into the system so that at age 65, on the first day of the month that you turn 65, you automatically will get your Medicare Part A. And the other part of Medicare is Part B. So let's talk about Part A for a moment. Part A, as in Apple. Part A is your inpatient services with Medicare. It is sleeping over for any medical event, including the following: hospital stay, skilled nursing, hospice care. Anything that involves medical treatment where you're sleeping over for a medical event is your Part A. Again, Part A is free. You've already paid for it all the years that you have worked, and now you're entitled to it. You receive it for free on the first day of the month that you turn 65. Now, will Medicare pay the entire bill for Part A services? No. Original Medicare will pay for 80% of your bill. If you go into a hospital, have skilled nursing, or hospice care. So that's Part A of Medicare. Now let's go to B. Part B, as in boy, of Medicare is all of the outpatient services. So it's the following: it's going to your doctor, it's going to a specialist, it's going to get lab work, it's going to get blood work, MRIs, CT scans, you name it, colonoscopies, mammograms, outpatient surgeries, cataracts. It covers durable medical equipment. Anything that involves medical services, medical treatment, where you get to go home that day because it's outpatient, falls under Part B, like boy, of Medicare. So A is inpatient, B is outpatient. Part B, let's stick on it for just a moment here. Part B will cost you a premium. They do charge a monthly premium. In 2021, it was $148.50. In 2022, it will be increasing to $170.10 for next year, every month for 2022. It is open enrollment right now, so this is important information for everybody to get. So Part B will cost you $170.10 next year, 170 buckaroonies and 10 cents per month. What does that get you? So it does cover all those items, all the outpatient items. There is a small deductible. Let's talk about the benefits. A small deductible next year, which the amount they announced is $233 for next year for 2022. This past year it was $203, so it did go up. Inflation, inflation, inflation. That's where we're at. They altered some things. They did give assistance to some prescriptions that didn't receive assistance before. Your Social Security benefits have increased. So yes, the Medicare premium went up, but so did the Social Security benefit. Okay, so let's move on. There's a deductible. That deductible for 2022 is $233. Once that out-of-pocket or deductible amount has been made or has been met just by simply going to your doctor's office or going for an outpatient service, you're going to meet that deductible. And once that deductible has been met, 80% of the bill is then covered by Medicare. Again, original Medicare. The money we pay into, the big Medicare fund we pay into, is who pays that 80% when you are on original Medicare. So that's the A and the B of original Medicare. Once you elect to take your B, and you will be required to take your B if the following: you're no longer working or receiving health insurance from either your own former employer or a spouse's former employer. You are required to take your B once you've turned 65 and after. Okay, if you don't take it, then you get a penalty later. You get a penalty, a lifetime penalty will be tacked on. So that means when you go to collect your Social Security benefits, There's going to be a lifetime penalty because you never took out your Medicare B. It can get you in a whole lot of trouble. So you need to speak to someone like me, my team, so we can hopefully help you not go through that. So that's what this video is all about, to prepare you. Okay, so we talked about A, inpatient. We've talked about B, outpatient. We've talked about how Medicare pays 80% of all medical bills. 20% left over is your portion. So what does that mean? There are 2 ways to be on Medicare. There is keeping your original Medicare A and B, which I just explained how it works, 80-20 program with a small deductible of $233, or you could go on a different program, a completely different program, a substitute program, a replacement program for your original Medicare. It's called Medicare Advantage. So Medicare Advantage, you may have seen lots of commercials. There's nonstop 24/7, every single moment. I'm talking to a client on the phone. If they have their TV blaring in the background, I only hear a few people's voices. I hear Joe Namath, I hear George Foreman, I hear Jimmy Walker, I hear the voices. They're all talking about Medicare Advantage. What is Medicare Advantage? Again, replacement, substitute. It takes you off the real Medicare, original Medicare, which I just explained, A and B. It takes you off that. You hand over the rights of that to a private insurance company to take over your Medicare for you. What does that mean for you? Is that a good thing? Is that a bad thing? It really does depend on your situation. Original Medicare is a great program. The one I explained at first, A, B, great program. Allows you to go to any doctor, any hospital. Medicare Advantage does not give you that freedom, so there's no freedom. Medicare Advantage, it's the replacement for Medicare. It puts you in a network. You're gonna have an HMO or a PPO network. You're going to have an HMO or a PPO network, and what that is going to do is make sure you're going to always have to make sure your doctors and hospitals do accept the coverage. And not only that, there are max out-of-pocket costs on a Medicare Advantage plan that are quite high. They're $7,550. That's where they are right now. They were $6,700. Now they're at $7,550, and it will keep increasing as years go on. If you choose a Medicare Advantage plan, you are allowed to switch off of Medicare Advantage once a year, which is October 15th through December 7th. You can go back onto original Medicare, the red, white, and blue card, the A and B program, the original federal program started in 1966. You can go back to it from October 15th through December 7th. However, remember, Medicare only covers 80%, only covers 80% of your bill. So that remaining 20%, we talked about Medicare Advantage. Does it pay the remaining 20%? No. It does cap out your max benefit, for lack of a better insurance term. Your max benefit for the year on Medicare Advantage is $7,550 in network. It's $11,000 out of network a year. So you do have a limit on your expenses, although someone on a fixed income can usually not afford $7,550, especially if they have a chronic condition and they have to repeatedly go back every year to get things done. Their bills are going to rack up. Medicare Advantage plans have been cited as the largest cause of senior debt in the United States. So just be cautious when you choose that program. Okay, let's go back over to this G. We have a Medigap we're going to talk about now. It's the other way to be on Medicare with original Medicare. So you have A, B, now you're going to have a G, a Medigap plan. So the government lets you say, hey, you can keep your real Medicare, but we can only pay you 80%. So 20% of that balance needs to go somewhere. Well, you have an option. You have 6 months prior to the date that your Medicare Part B, like boy, begins, and replay that if you didn't catch it, when you are able to take out a Medigap plan. Plan G is what most people go with. G like Georgia, G like girl, good, great. Letter G. It is a standardized, federalized, lettered plan that came out back in 1966 when Medicare was originated. these letters also came out. So Plan G today in 2021, heading into 2022, is the most comprehensive plan that you can think of. It allows you to use your real original Medicare. It lets you go to any doctor, any hospital in the entire United States. And it pays the 20% of the bill. The only out-of-pocket cost you have for the entire year that you're going to be billed is that Medicare Part B deductible, which equals $233 next year. So once you've met that amount of money in medical bills, you have 100% of your bills covered. 100% of your bills, you can go anywhere you want in the country. Amazing stuff, right? What's the catch? Well, here's the catch. So again, I may have said it before, but you're only able to get a Medigap / same name Medicare supplement plan using your original Medicare when you first start on Part B of Medicare without any medical underwriting questions. Let me say it again. You can only get Medigap. That means you can only use original Medicare with a Plan G Medigap that's going to pay all your bills. You can go to any doctor you want. Your only out-of-pocket's $233. But you only have a 6-month window prior to your Part B, as in boy beginning, to get one of those plans without medical underwriting. Some states do give you another 5 months after, but general rule, you have 6 months prior. You have a little 6-month window when you're turning 65 to get Medigap without any medical questions. Not only when you're turning 65, you could also be a person that decided to put off retirement and is still on their work insurance, and they take their Part B, as in boy, at 66 or at 70 years of age, and that's when they pick up that letter B, part of Medicare. At that point, you will go back 6 months, and you have that 6-month window prior to your Part B like boy effective date where there are no medical underwriting questions. So that was the catch. So it gives you everything. It gives you the most amazing world of health insurance you could possibly think of. You get to go to any doctor. You get to go to any hospital in the country. You have any ailment. Every bill is paid except for $233. There's one other little catch. There is a small premium. Most states, it's not too bad. Some states are higher than other states. Typically, your premiums are going to run in the low hundreds a month. So $100 to $110, $112. It could be lower. It could be slightly higher. Depends on your state. So those prices are state by state, and it's based on your age typically, and it's based on a couple other demographic factors that would determine your rate. So that's all the information. So you choose either Medicare Supplement or you choose Medicare Advantage. There's lots more information on Medicare always, but just so you understand, the most important thing is to take the right step in the right direction when you first start on Medicare, because if you don't, and I get calls every single day from people who did not, it can really put you in a very bad spot moving forward with your health insurance. And health insurance is important as we grow older. It keeps us in check. It keeps us around for our loved ones, for our children, grandchildren, important stuff. Want to help you. We want to keep your costs as low as possible. Give me a call. Holly Cohen, Preferred Medicare Plans. I'm going to keep filling you in on all these Medicare secrets. You all have a really good day. Bye-bye.